These are the number of healthcare personnel beginning to deploy this morning to 50 hospitals across the state to meet the staffing shortages in our hospitals. This medical staffing was secured through utilization and awarding of 4 of the original 19 bids that MEMA received on August the 13th. Put differently, we are deploying over 1,000 healthcare personnel within 6 business days of the RFQ closing and within 9 business days of the Department of Health official ask. Of course, as you know, when in the middle of an emergency, there is no distinction between a business day and a Saturday or a Sunday. This, in my view, is an impressive feat, and I'd like to thank MEMA and the Department of Health for helping make this happen so quickly. Onboarding this medical staff will be phased in over time. Level 1 and Level 2 trauma hospital requests have already been fulfilled, and Level 3 hospital requests are currently being processed and fulfilled. I mentioned earlier that we are deploying to 50 hospitals today. We anticipate that all staffing requests for the 61 hospitals that made them should be met no later than the end of this week. In addition to the personnel I just mentioned, a 23-person active duty team arrived in Jackson as part of the Department of Defense COVID-19 response operation. 20 of the 23-person team are active duty Air Force medical personnel, while 3 of those 23 are part of a command and control element. Today, we are anticipating another 23-person team of active duty Army military personnel. They are in processing in preparation to provide assistance in Tupelo. Like the first team, 20 of those 23 will be medical personnel and 3 will serve in a command and control element. U.S. Army North, under the U.S. Northern Command's oversight, will provide operational command of the active duty military COVID-19 response team. I've said this multiple times throughout this pandemic, but I'll say it again. My top priority throughout the pandemic has and will always be protecting the integrity of our healthcare system. We have been working around the clock to secure additional medical personnel through both federal and private sector sources to shore up the staffing shortages that our hospitals find themselves in. Getting boots on the ground this quickly is a step in the right direction. I'm grateful to each and all of the healthcare professionals who are working day and night to take care of our fellow Mississippians, and I'm grateful to those who are coming here to help. Having these staffing needs met will help to alleviate a portion of the strain on our healthcare system and ensure that all Mississippians that need care will receive the quality care they deserve. In addition, last week we administered over 81,000 vaccines. Of those, approximately 53,000 were first doses. We have now been distributing vaccines for 36 weeks in Mississippi. This number of 81,000 is the 11th highest total out of those 36 weeks, and it is the 6th week in a row that we have had week-over-week increases. It is the largest number of vaccine doses that have been administered in Mississippi since the middle of April. As I have repeatedly done throughout this year, I encourage each and every one of you to consult with your doctor, study the facts, and decide what is best for you and your families. I will continue to defend your right to make your own choices about your health care. That being said, the facts continue to point to the vaccine as being safe and effective and the best way to preventing serious illness and death as a result of COVID-19. According to the latest data, and I know Dr. Byers probably has data that is updated one day after this, but according to the latest data as of Sunday, there were 1,563 people in the hospital fighting COVID, which is down from our most recent peak of 1,667. 465 patients were in the ICU. The most recent data also continues to show that 98% of all new cases, 89% of all hospitalizations, and 87% of deaths are amongst those who were not fully vaccinated. While we have a long way to go, there is hope. We are now starting to obtain the medical personnel needed to alleviate some of the stress on our healthcare system, and we are continuing to see increases in vaccinations. I truly believe that if we all continue to do our part, if we all continue to work together, we will get through these challenges. Now, before I turn it over to Director McCraney and Dr. Byers, I would like to take a moment to discuss another item that has been in the news for months and will likely be in the news over the next couple of days. Tomorrow and Thursday, members of the legislature will be holding hearings to discuss the future of our state's income tax. I want to personally thank Senator Harkins and Representative Lamar for working on this issue and for having these hearings. I'm also glad that the Lieutenant Governor, the Speaker, and I all agree that the income tax should be eliminated and that doing so best positions Mississippi for long-term success. I hope that once the hearings are over, the legislature will realize that eliminating Mississippi's income tax is needed and reducing the tax burden on Mississippians across the board is the best way to ensure our state's economic prosperity. I hope that once the hearings are over, the legislature will realize that the best way forward is to not swap the income tax for increases in sales taxes, agriculture taxes, and other taxes. If you agree with me on that we should eliminate the income tax without raising taxes in other areas, I recommend you mention that to your legislators. I've said it before, and I'll say it again. I'm opposed to taking less from you here and taking more from you there. I'm opposed to robbing from Peter to pay Paul. I've been in contact with many small businesses across Mississippi, including in the manufacturing and agricultural space, with outside think tanks and many other stakeholders. Based on my conversations with them, it's clear. The consensus is that eliminating, not swapping, the tax burden is the way to go. Today, Mississippi stands in the best fiscal shape and the best financial shape we've ever been in, thanks in large part to Mississippians' willingness to go back to work despite this global pandemic. Thanks to them, Mississippi ended the most recent fiscal year over $1 billion above original revenue estimates. As Lieutenant Governor, I was proud to propose the largest tax cut in Mississippi history. We were able to get that done, eliminating the 3% income tax bracket without increasing anybody's taxes. We did it before, and it is my firm belief that we can do it again. Now is the time to get this done. We can no longer kick the can down the road when it comes to getting rid of the income tax. Every single day, we are competing with Texas and Tennessee and Florida for investment capital. Every single day, we are competing with Texas, Tennessee, and Florida for human capital. if this doesn't happen now, if we swap taxes instead of eliminating them, we will never be able to do away with them once and for all. With that, I want to thank Director McCraney and Dr. Byers for being here. I'll turn it over to Director McCraney first so he can talk about some of the specifics. Director McCraney?
Thank you, Governor. Just want to expound on what the governor kind of talked about earlier and give some specifics, and also to let you know that by Friday of this week, we will do a release on all contracts, all hospitals that have given orders. So we're still putting that together. But right now, it's 1,046. I mean, in 11 business days that we've been able to do and get out to the hospital. So what does that really mean? That means about 994 hospital beds. Specifically, that's 757 med-surg and 237 on the ICU side. So that's significant. That's going to relieve the pressure in 50 hospitals who've made requests, and as we work the next 11, we'll add those numbers in as well. So I think that's very important. I think there's another note that needs to be made. There was a lot of conversation early on about a state of emergency. When do you stop having a state of emergency? I can guarantee you, if I did not have a state of emergency in effect right now, we would not have done this in 11 days. It is impossible under state law to do that, but through the guidance of the governor and his staff and the abilities for us to operate under a state of emergency, we were able to issue those RFQs, the request for quotes, get those processed, and get these folks en route to Mississippi, which I think is significant. And that needs to be maintained. On the backside, I do want to talk about, and I can answer questions later, Tishomingo County had a storm over the weekend. I do need to kind of give them a shout out. We've got no destroyed homes at this time. We've got 8 major, 17 minor, and 33 affected homes up in that area. We had a tornado that came up very quickly on Saturday and over the weekend, as you saw some of the flooding in Tennessee. And we've had some of our staff there, as well as the local emergency responders. We've been responding to that since Saturday, and I'm glad to report that we have 8 Days of Hope. We also have VOAD, the volunteer organizations after disaster, have been deployed, as well as the Southern Baptist, and we've been in there with TARP missions, and we're also going in with our individual assistance officers to work with that county as well. Governor, that's all I have for right now.
Thank you. As has often been the case throughout the pandemic, Dr. Byers steps in very capably for Dr. Dobbs in his absence, and at this time I'm going to turn it over to Dr. Byers.
Good morning, everybody. Thank you, Governor. And I want to thank the Governor, and I want to thank MEMA and the Director for their efforts in helping our hospital capacity throughout the state. I think this is going to make a huge difference for us moving forward. If we look today at our numbers we're reporting out, 3,291 additional cases, and unfortunately 111 additional deaths. Now, this is the highest total of deaths we've had to date so far during the pandemic. The previous high was back in January, when we were having our large peak over the winter months. When we look at those deaths, guys, we're looking at about 87% of them are not vaccinated, not fully vaccinated. When we look at the breakdown of the deaths, more than 50% of them are over the age of 65, and a good number of those individuals, 75 and older, 75% or more are not fully vaccinated. So we are still seeing an impact in our older individuals, and we do know that the vaccine is very protective for these folks at preventing the severe complications and illness that can occur. Now, when we look at our hospitalizations over time, we have begun to see some flattening off in our hospitalizations, in our ICUs, in our ventilator use. Today we're reporting out 1,655 individuals who are hospitalized. So that's a little bit higher than yesterday. But if you look at the trends over time, it looks like we are leveling off in the number of hospitalizations. This is the good news, and I really want to talk about some of the things that we're seeing right now. Number one, when you look at our cases over time, it looks like we are beginning to plateau. A couple of days does not a trend make, but it does look like we're moving in the right direction with our case numbers. It does look like we're starting to have some leveling off with our hospitalizations. Certainly, we've seen that with ventilator use and ICU admissions as well. But we have had some increased deaths. And we do know from our experience that when we have big surges in cases, that the deaths often follow several days later, once an individual becomes ill enough to become severely ill. And so we may anticipate some significant increases in our deaths still. We're going to watch that. And some other good things that we see are the impacts of monoclonal antibodies. And we do feel like that this is a life-saving measure. We feel like this is what is additionally helping our hospital capacity. We know that individuals who are infected, if they get monoclonal antibodies early in the course of their illness, that it can prevent hospitalizations, it can prevent deaths. And we've seen an increase in the utilization of monoclonal antibodies throughout the state. We've seen the increases in the vaccinations that the governor mentioned, and we anticipate that we'll continue to see those. Now, at the health department, we do have the availability for the third dose for people who are immunocompromised now. They can make that appointment on our vaccine scheduler on the website, and basically they're able to self-attest that they have an immunocompromising condition, and they are able to make an appointment for that third dose at a county health department now. This is good news. And additionally, and you all saw this, that the FDA did give approval for the Pfizer vaccine, full approval for individuals 16 and older. This is a great step in the right direction. We feel like that for many of those people who may have still been hesitant, may have still been on the fence, that we will see some increases in vaccinations as a result of that. And I believe that that's the report for today.